Okay, let's go over the quadricep muscles. A lot of people don't know there's actually 4 of them. They just think it's actually just one muscle there, quads. But the first one we're going to go over is the rectus femoris, or some people say femoris. So it starts in the origin is the anterior inferior iliac spine. So right down here. Then it will actually go down to the tuberosity of the tibia. So again, where the insertion is, that's a lot of times where the action is to the muscle. So the major action extends the knee. So when the foot goes straight up like this, that's extension in the knee. So for the rectus femoris, you have to feel the patella, again the kneecap, go up about 2 to 3 inches, and it's right in the center there. And again, if you can't feel it, have them hold down their foot, have them try to lift up their foot, so you can kind of locate that region, and then have them relax, so you can palpate that trigger point. And for the referral, it can technically go down right to the patella then, okay? So the next one, we're going to find the ASIS, anterior superior iliac spine region, go down about a couple inches, and that one, again, if you can't feel it, go cross fiber friction a little bit, and that one can go to the anterior part of the knee for the referral. Next one is the Vastus Intermedius. So the Vastus Intermedius, what you want to basically do for that one, hold down the foot, have them try to lift it up, and you want to go underneath the rectus femoris and have them relax. You can locate that right there. So you're going to kind of hook underneath of there, and that's the typical trigger point for that region. So again, with trigger points are kind of tricky in a way. If you're just a little bit off, you're not going to get that total referral. So that's why you can just slide a little bit back and forth. And for the typical referral, we'll actually just go down a little bit on the anterior portion. So also with the action, it extends the knee. And then the Vastus lateralis, there are many of them. So a good way to locate this one, you can be on that side, and you can just kind of rotate it up like this. And this band right here is actually called an IT band, iliotibial band right here, okay? So you got to kind of go cross fiber friction, especially runners, and they actually call it runner's knee, when the hip kind of externally rotates out like this. So it gets really tight in that region. You want to feel the patella, and there's 2 trigger points here and here. You can feel kind of a tight band. And a lot of these around here will actually refer around the lateral side of the knee. And then there's also ones halfway up. There's like 3 of them. But again, make sure you find the IT band. Make sure you don't push on the IT band. And you can locate those regions here. There's also ones a little bit higher up in here too, so we'll actually refer around here for the typical referral. So again, a good idea. A lot of people do not like to actually just hold those trigger points, so that's why you can go 1 layer a little bit deeper, but again, slower the better for locating those tender areas. And you can usually feel a little bit difference in the muscle tissue to kind of locate those areas then. Vastus Medialis. So you're going to externally rotate a little bit just to locate that. So again, the rectus femoris, you can use that as a landmark for these muscles here. So these will typically refer around the medial side of the knee. So the easy way to remember that is the rectus femoris is directly center, so it'll go to the anterior part of the knee. Vastus lateralis, more the lateral side of the knee. And Vastus medialis will go to the medial side of the knee then, okay? So you want to feel the patella and just go up a few inches. That's 1 trigger point there. And go up a few more inches, and that's another one. So technically, just don't go up higher than half, and then that's other muscles we're going to be getting into in that region then, okay? So again, Vastus medialis, so medial side, Vastus lateralis, lateral, rectus femoris. Rectus actually means straight, that's the meaning of that. And Vastus intermedius, so that's the deepest quad, so it's underneath the rectus femoris then, okay? So that's what the quad's then.